Hey everyone, this is Mike. Welcome back. So today we're going to talk about how would a choice theory or reality therapist treat OCD. So choice theory developed by William Glasser posits that all human behavior is an attempt to satisfy 5 basic needs that are genetically encoded. These needs are survival, love and belonging, power, freedom, and fun. Rather than seeing psychological symptoms as mental illnesses, choice theory views them as creative, albeit often ineffective ways individuals choose to behave to meet these needs. Therefore, a choice theory therapist treating OCD would focus on helping the client understand how their obsessions and compulsions are their current best choice, even if painful and dysfunctional, to satisfy one or more of these basic needs, and then guide them to make more effective and responsible choices. Here's how a choice theory therapist would approach or might approach OCD. Understanding total behavior. Choice theory emphasizes that all behavior is total behavior, consisting of 4 inseparably linked components: acting, thinking, feeling, and physiology. We have direct control over our acting and thinking, and indirect control over our feelings and physiology. For OCD, the therapist would help the clients see their compulsions, acting, and obsessions, thinking, are chosen behaviors even if they feel them involuntarily. The associated anxiety, feeling, and physical sensations, physiology, are then seen as consequences of these chosen behaviors. Identifying unmet needs. The core of the treatment would involve exploring which of the 5 basic needs the OCD behaviors are attempting to fulfill. This is a crucial shift in perspective. Survival. Perhaps the compulsions are an attempt to ensure safety and security, even if illogical. For example, checking locks repeatedly to prevent harm. Love and belonging. OCD might be a way to avoid rejection or gain approval, compulsive confessing or trying to be perfect to be loved. It could also be a result of a lack of fulfilling relationships. Power and achievement. The need for control over one's thoughts or environment often manifests as obsessions and compulsions. The desire for perfection or certainty fits here. Freedom. The struggle to be free from intrusive thoughts or the need to avoid certain situations could be a misdirected attempt at freedom. The rituals themselves become a form of perceived control, thus a form of freedom. And fun. While less obvious, the relief experienced after compulsion, even if temporary, might be a fleeting attempt to experience something pleasurable or reduce discomfort. The quality world and perceived reality. The therapist would explore the client's quality world, their unique internal picture album of what they want, who they want to be with, and what values they hold. OCD often creates a significant gap between what's in their quality world, for example, a peaceful, productive life, and their perceived reality, a life dominated by fears and rituals. The therapist helps the client identify this discrepancy and the pain it causes. Challenging external control psychology. A central tenet of choice theory is that we only control ourselves. The therapist would highlight how believing that external factors, intrusive thoughts, potential contamination, are making them feel and act a certain way is an example of external control psychology. The therapist would consistently redirect the client to focus on what they can control, their own choices in thinking and acting. Focus on present behavior and planning change. Choice theory is present-focused. The therapist would help the client examine their current behaviors, obsessions and compulsions, and evaluate if they are effectively meeting their needs. They would then collaboratively brainstorm and plan new, more effective behaviors that genuinely satisfy their needs without the distress of OCD. This might involve wants. What does the client truly want? Peace, genuine connection, a sense of accomplishment. Doing. What are they doing now? Thinking and acting. Evaluation. Are their current behaviors getting them what they want? The answer for OCD is usually a clear no. And plan. What new things can they do, thinking and acting, to better meet those needs? Empowering responsible choices. The therapist would emphasize the client's inherent ability to choose. Instead of viewing themselves as victims of their OCD, they would be empowered to see themselves as choosing, albeit often unconsciously at first, these behaviors. This empowers them to choose differently. The conversation might shift from "I have to do this ritual" to "I am choosing to do this ritual and it's not getting me what I truly want, so what else can I choose?" Integrating behavioral techniques similar to ERP but with a choice theory rationale. While not explicitly ERP, exposure and response prevention, a choice theory therapist might utilize behavioral experiments that resemble it. The rationale would be that the client chooses to expose themselves to a feared situation and chooses to resist the compulsion, not because an external force demands it, but because it's a more effective choice for meeting their underlying needs. For example, the freedom from the OCD, the power over their thoughts for a more fulfilling life. The therapist would help the client see how resisting a compulsion is a choice that leads to greater long-term need satisfaction, even if it feels uncomfortable in the short term. Example dialogue. Client, I can't stop checking the stove. I just have to know if it's off or something terrible will happen. Choice theory therapist. I hear how strongly you feel compelled to check. When you check, what need are you trying to meet? Is it about feeling safe, survival, or perhaps having control and certainty, power? And when you do check, does it genuinely give you the feeling of safety and control, or is it a temporary relief that leads to more checking later? Client, it feels like safety, but then I doubt it again. It's exhausting. Choice theory therapist. So the checking isn't really getting you lasting safety or power, is it? It's actually taking away your fun and freedom. What could be a different choice you could make right now that would genuinely move you closer to feeling truly safe or having more control over your life, rather than being controlled by checking? In essence, a choice theory therapist would help someone with OCD recognize that their symptoms are behaviors that they are choosing, often unconsciously, to satisfy their basic needs, and then guide them to make more effective, responsible, and need-satisfying choices that ultimately lead to a life free from the grip of OCD. So what do you think about reality therapy and choice theory in treating OCD? Let me know your thoughts in the comments, and I'll speak to you next time.